welcome to the Centre Think Tank interview series in Conversation. My name is Torrin Wilkins, the Director of Centre Think Tank, and today we'll be discussing how we fix the NHS, the role of physiotherapists, the assisted dying bill, and also how we support small businesses. With me today to explore these issues further, I'm delighted to be joined by Sonia Kumar. Sonia has a wide range of experience, including as the Member of Parliament for Dudley since 2024, and she also previously worked in the NHS. She's seen firsthand the issues we'll be speaking about today with her time in the NHS and her continued campaigning for the service as an MP. So thank you so much for joining me today, Sonia.
No, thank you for inviting me. It's a real pleasure.
So to jump straight into my first question, so you worked in the NHS for over a decade, and I'm sure you've seen firsthand the amazing work that NHS staff do, but also the areas the service sometimes struggles. So how did your time in the NHS shape your view of the service and what needs to be done to fix it?
Well, first of all, I'll say that colleagues that work in the NHS are absolutely commended on the work that they do. A lot of the NHS workers work day and night. They'll do extra shifts. They'll do extra hours working during lunchtime, come in early, leave late. And a lot of it's worked on goodwill because we just want to provide excellent care for patients that are coming in. So in terms of what shaped my narrative is that actually there's some fantastic clinicians there, but they need the tools to be able to deliver the services that they want to see. And I was one of those clinicians. So I worked as an advanced practice physiotherapist and first contact practitioner. So longer title for my name, but it was basically working in an interface service at the Dudley Group Hospital, at the guest hospital on that site. And then part of my job was working as in the GP as a first contact practitioner. And I think when I was working in those two areas, you realise that when you refer patients onto, orthopaedics, whether you refer them to mental health service or social prescription, the length of them waiting for appointments is just phenomenally long, and you start to think, why are patients waiting so long, and why are services that are essential being scrapped because we just don't have the funding for it. So because of the lack of funding the last 14 years, it's just made me think we need more clinicians going into politics that have real life experience and know what they're talking about. So I am a staunch believer that the NHS be free at the point of contact. I will not agree with privatising the NHS in any time in my life. I think it's brilliant that we've now brought in 2 million more appointments, which has been delivered, a promise that we did at the election, which is, I think, fantastic news for clinicians and patients to alleviate some of that pressure. And really what's shaping my opinion is that I think we just need to start thinking about the NHS in a different way. Initially, we're set up for acute care, and now we're getting patients that have got chronic conditions, multifaceted problems, and we need to look at it in a more holistic manner, which I don't think we're doing as well as we could be.
So in terms of this sort of multifaceted aspect of the NHS, I mean, of course, at the moment, some of the big pressures are coming from social care, mental health care. So is that really some of the root causes of the NHS crisis, or is there a lot going on within the NHS itself? So is it about sorting out the sort of periphery services as well, or is it just a sort of NHS-focused problem?
I think each hospital is unique and it will have its own issues. I will say that in particular, there's some hospitals are financially quite healthy, and they're building revenue from different aspects, whether it's hiring or using community and doing work in the community, while other trusts are struggling. So I think there needs to be definitely some sharing of information. Now, I worked at a hospital where we're still doing handwritten notes at King's College, and I initially started my career. They were doing electronic notes, and that was right at the beginning of my career a decade ago. And you can see there's a massive difference and disparity between region to region, and then of what work is being done. So I think we need to learn from each place. So there are things that are going well, and I think sometimes we don't celebrate that in the NHS. I think there's all quite a picture that gets sort of painted is that it's terrible, people aren't getting seen. But actually, there's sort of the the cases where people are getting seen and getting some fantastic care, they don't get celebrated, they're not highlighted. So that's the first thing I want to put on the record. And in terms of what needs to be done, I think mental health is definitely a service that wasn't really inbuilt initially. And I don't think the recognition of the importance of mental health and physical health on same parity has been at the forefront of policy. And I think, we are taking it serious now as a Labour MP and a Labour government. We are taking this very seriously and full on. So I'm really pleased to see that gap is getting closed. And that's not just in adults, but also paediatrics. Having gone to so many schools in my constituency, the one thing they say again and again, when we refer, our children to services for mental health or for an assessment, it just takes too long. Now, it's not the clinician's fault, it's just the fact that we haven't got a workforce. So when I think about the issues that we have in the NHS, it starts from the fact that we've been looking at a lot of secondary care, not primary care, and community-based work, which I think is something that is essential. So when we start about that, we're also looking at preventive measures. We need to think about prophylactically, how are we treating the general population to understand what a healthy lifestyle is, and to ensure that they're not even touching primary care in the first place. And that move is essential. So for me, that's where it starts. Before we get anywhere else, the next bit would be is actually making sure that when we have services, when people do come to a GP, that they're getting to see the right clinician. Now, there's a lot of talk about, empowering GPs and making sure that they've got more GPs, more appointments, and them getting the ability to have to be able to go for radiology or for imaging. But actually, 25% of patients that come into GPs are musculoskeletal patients that need a specialist MSK physiotherapist that would see them. And I think we need to be sort of really banging that drum. And I'm someone that bangs the drum about AHP, so allied health professionals and physios that work in GPs that are essential for that care. So getting the right clinician and getting the right person at the right time, I think, is essential. And then waiting lists are important, that we are making sure that we're optimising, are these patients going to the right route of care and the pathway? So if you're going to see, you've got a back pain, if you've got knee pain, or I don't know, you've got a simple flu or something like that, you could see by a nurse, or you can see by a physio or a first contact practitioner, or whatever you want to name us, yeah? That then the waiting list is short enough so that they're not on the waiting list for so long that they're now coming out of the workforce, and we're losing labour force and economic the value. And I think whenever I talk about healthcare, I always talk about actually the economic value that we're losing and the inactivity that we have. And people don't always link it together, which is so frustrating, that you cannot have a workforce if they're not healthy. And then you're right, when you talk about health and social care, it's something that so many governments have just tried to tackle, about how we manage people. We get to the end of the sort of the end part of their journey. So they've gone through primary care, gone to secondary care. Now they want to be released from hospital and moving them out back into a more enabled life and improve their quality of life. It's that discharge planning, which is the sticking point, having worked towards myself. So it's got to be cross-party. I don't think this is something that Labour we were going to do, and I think Wes Streeting has welcomed a cross-party approach. I think because we need something to stick, and that it will be future-proof, and it has longevity. We can't keep changing the health and social care policy every 4.5 years, or whenever there's a new government. It doesn't work. We need some stability of what we tackle. So yeah, I think it's multiple facets there, I think I've spoken about. So yeah, I think that's what I would say.
And sort of linking on your point about the technology side of the NHS, and one of the greatest challenges I think the government faces is integrating AI and making the NHS more digital. And I've heard of plenty of issues. I had some myself actually with vaccines and getting across borders, and NHS systems not talking to each other. So I've seen that one myself, but. Did you ever see that issue within the NHS yourself, and how do we actually streamline NHS services using technology?
This is probably my biggest bugbear as a clinician. I think every clinician you speak to is the fact that digitisation of the NHS is just not happening fast enough, really. If you refer someone for a image, an MRI, you can do it at Dudley group of hospitals, but then if you want to get that image to Birmingham to the Royal Orthopaedics and send someone to sort of tertiary care, they may not get that image. They may need to re-image again, which is a colossal waste of money. So I think integrating services, not just in the, we're saying nationally, even regionally would be a good idea, so that people aren't duplication of their imaging or their results or whatever investigations that we're doing, I think is essential. I think starting with some basics, it said, the days that I'm still writing handwritten notes, and we're getting a wad of notes, as you can imagine, sending them down to the clerks in the basement, getting archived for X amount of years. Those days really need to disappear because it's just not efficient. It's not efficient in any way or form. And for me, digitalization is definitely a route forward in a positive way, whether it's writing notes, whether it's imaging, and whether it's just detecting disease earlier. I've spoken to a number of radiographers, and they're saying about how AI looking at chest x-rays and CTs and how we can pick up pathology quite early on. Not because radiographers aren't fantastic, because those colleagues of mine, I've worked quite closely with and to do some brilliant work, but it's just making sure we're using AI in a positive way and using the tech innovation in a way that is enabling our patients to have better care in the service. So yeah, I am very much pro tech being incorporated into the NHS, and I think it's about time that we started, and I'm really glad that we've started to think about how we can do that.
Brilliant. And an area that you also spoke about recently is the vital role of physiotherapists in tackling MSK and the need for increased investment in that area. So what would further investments be useful for? And more widely, how can we better support physiotherapists?
I am a staunch supporter of physios. So as an allied health profession, that's the umbrella term. There's 14 professionals in that. The MSK, so physiotherapists, sorry, should I say, hold the biggest workforce in that group of 14. And that doesn't dismiss the professionals, because I think they are so important. Just because they're smaller, their voices aren't always heard. And we need to be looking at, when we're looking at physiotherapists, is what they can do. So I believe, and it's one of the things I said in my debate, is that we need to be thinking about healthy lifestyles from day one from birth to the end of life. Because if a child's born with any disabilities or any MSK conditions, then they're having the right care then. So, whether it's great re-education, whether it's neurological conditions, or when it comes to end of life and palliative care, and we're looking at how we can improve patients, the last days in a dignified manner. And that might just be, they want to be able to walk from A to B to go to the toilet, to be able to just do their bodily functions in a way that is, they feel comfortable. Now, for me, I'm a very big staunch supporter of physios, and I would, if I ever was in the place where I was needing palliative care, I would want to make sure that I can at least look after myself, because that's just something that I want. Now, everybody's different. Someone might say, actually, I would just like to make sure that I can go for a walk. It's whatever the goal, whatever's meaning for you and that purpose for you, that we achieve it. And I don't think there's a big enough onus on it. And I think I will say this in my debates, and I was talking about cardiovascular disease on Thursday, and I talked about cardiac rehab, again, another place that people don't realise that physios are integral. So I think it needs to be in all aspects of when we're looking at, and it comes back to when I was saying about first contact practitioners being physios in primary care, that we are recognised of the importance of them. And then when we're looking at, as we go through, whether it's MSK problems, neurological strokes, neurorehab, lung conditions, ITU, these are all places where physios put their hand in to help people be enabled to be able to get on with their life. And I think see an increase in the workforce for all AHPs, or allied health professionals. And I believe that we cannot have a resilient NHS without a full MDT. And the allied health professions are integral on the MDT, because when you come into hospital, you'll see clerked in by a receptionist, you'll see a HCA, you'll see a nurse, then you may see a physio, you might see the occupational therapist, you get enrolled into the ward, then you'll see a speech, maybe if you've had a neurological problem, you might see a speech and language therapist. You might be referred down to podiatry for an insole. There are so many professionals that go in there in that journey of your care. And so one of the benefits of the AHPs, we normally spend longer with patients, so we will affect your quality of life. You will spend 45 minutes with a or OT or speech and language therapist, where the doctors and nurses, and that's not dismissing what they're doing, because as I've said, they're integral, but I want to make sure that we are highlighted on what we do and what benefit we bring.
So one of the debates recently, and we touched on it there slightly with end-of-life care, is of course the assisted dying bill that's going through Parliament at the moment. And you said one of the reasons for voting to support the bill was your experience of, as you put it, the trials and tribulations of patients in their final days. So what issues did you see in the NHS and more widely that made you vote for the bill, and what can be done to improve the bill? Is there any changes that you think could be made?
So I voted for the bill because I felt like it needed debated. I think we've got a democratic process where we have a committee where it will go through line by line, word by word, and just look at the bill and what we can do to scrutinise it and put amendments forward and how we can strengthen it. I don't think on a second reading, I believe it was a right idea for us to say this is no longer debated further on. I think the public have wanted that to be happen. Whether I vote or not on the third reading, I will need to read the bill myself in detail and what's been amended. I know change in terms of what we do in terms of a judge and how we have a psychologist and how we decide on the decisions at the end of life of care. But I'm not going to say yes, I'll definitely vote for it on the third reading. For me, I need to have a read through the whole bill itself, what's been amended, and is it good enough for patients? So when I was working in ITU, so I did a stint on ITU and I worked on care of the elderly as a junior physio and rotating. There are patients that will not tolerate pain relief. So these people are going to be in dire pain for days and weeks until they have their lasting breaths. And I believe I'm pro-choice. I believe that if somebody wants to have a look at their life and go, right, I've lived a fantastic life. I'm 98. I've lived my life. I've got allergy to these drugs, or I've decided for whatever reason I can't take them. I mean, I've got severe cancer. I've got metastases all over. I don't want to now decide to prolong my life when I know I can live a life in a dignified manner. And I've got 6 months to live. I've been spoken to a doctor. I've had a mental health assessment. I know I'm compass mentis. It's consented. There's a lot of things that need to say yes for me to say we need to go forward. Then I think you should have a choice about whether you would like to end your life. Like, I don't believe it should be in our hands as a government. I think it should be in the hands of patients. This is not a choice that I would think we should be on everybody. It's not one for paediatrics. It's not for those with mental health. The bill initially has taken out a number of patients that potentially could be targeted by this. So to safeguard some of these things, they've been put aside. So the experiences I've had, and I thought, I look at the suffering of patients on the end of their life, and I wonder, and those people with neurological conditions said to me, Sonia, I'm done now. Don't want to be here anymore. And those days are dark, especially when that you're in pain and you've got a terminal illness. And that's the thing that we've really got to highlight with this bill. It's not for everybody. And I think a number of residents that come in to see me in surgery saying they're really quite concerned about it. And when I said actually it's for terminally ill, they did, okay, that makes more sense. Okay, this is not a blanket referral system that you have to go through. So for me, I look at those when I was working at those in the hospital, and with those really vulnerable people, you're in really dark moments, and lots of people just talk about this. So when you see a patient and they're saying they want to end their life, they're not going to just tell you; they're going to tell everybody, and those discussions will happen. Through the MDT. As a physio, I would have that discussion when I'm they're wanting to walk, do some palliative care in terms of walking and whatever it is, or the OT with, getting if they want to just make their own meal, or they put their meal in some, in the oven, or whatever goal they wanted to achieve. Yeah. So we should be really quite open with our thoughts about this and think, what is the best decision that I can make for patients? And that's how I see it. I don't put my hat on, my MP hat on, I put my clinician hat on. And I think there are so many safeguards. Every single person that's in contact with that patient, it has a safeguarding responsibility to look out for, behaviors like preserves behavior, mental health behavior, things that they would concern to think, oh, they're not ready to make that decision. And you would always highlight that in the MDT meeting and a handover in the morning. So yeah, that's the reason why I would say we need to be really quite sensitive with this matter. But I think patients should be at the core of what we're doing. And those people that are hesitant about this bill, I think be open-minded, and I'm quite open-minded to see what's going to come out of this at the end of it, and decide then.
So for the last part of this interview, I want to speak a bit about the economy and small businesses, of course, some of the things that fund the NHS itself and grow our economy. And it's something Labour has been very vocal about, and something close to your family, as your dad ran a green grocery for more than 45 years. So how do we protect small businesses, especially with the cost of living crisis and economic instability around the world?
So I'll just clarify, my dad's still running his greengrocers. He's over 70 now, and he's still quite keen to get up in the morning, go to the market, get the fruit and veg and stock up. I have told him he needs to retire, but I don't think he is quite, he's not quite there yet to take down his, the shutter's come down. He still wants to continue working and serving the community, which is something that I admire about him. And it's one of the values that's been instilled as me is, community is essential when you're looking at giving back. So yeah, that's what I was going to say first of all. And in terms of the NHS and small businesses, I am from an SME myself, so it's why I put myself forward to the business and a trade committee, which I was successful to be elected onto. I just graduated from my business and my business MSc from Aston Uni, so I just thought, right, this is theory in practice. It'd be great to put it into play. Now, I think we need to be sort of leveling the playing field really for permanently by cutting business rates from shops, pubs, and leisure centres and properties, so that actually the high street has got an ability to thrive. Labour's sort of committed to lowering these rates and ensuring that the online giants that have that competitive advantage, that they are re-levelled and that they pay their fair share of tax. The retail crime and funding prevention and trade for police in terms of training. One of the things that we always get is petty crime, people just stealing bottles of wine or bottles of alcohol, or bits and pieces they shouldn't do. And actually now Labour's put a policy in that anything under £200 can be reported, and it won't be ignored, which I think is fantastic for small SMEs. We've also increased the contribution threshold to 10,500 to help small businesses thrive, and then an additional 250,000 properties, including pubs and high street shops, will receive 40% off their business rate bills. So I think we've got to look at what we're going to do about these shops that we have got, and then what do we do with the empty shops. So I've been started to run a campaign about how we tackle empty shops. The government's given powers to councils, so shops that have not been open for a year is to them to open. Nobody wants to go on the high street and have 37 shops, which is like in Dudley at the moment, they're empty. They want to make sure that these shops are filled with local businesses, SMEs, so that when people come into the town centre, market centres, or wherever you are in the country, that you've got a place to eat, you've got a place to get some entertainment, get a place to shop, and a place to be proud of. I think heritage is really important in places like Dudley, and people are really proud of where they've come from. And I'm proud that I've opened my office in the town centre, so I'm occupying one of these empty shops that people come and speak to me. So yeah, I think Labour's got a lot that it's putting forward already, and it's protecting our micro businesses, which are a lot in my constituency. But more will be rolled out as the industrial strategy we rolled out in the spring, which I'm really quite looking forward to.
Well, thank you so much for taking the time to join me today to discuss the NHS, the economy, and so many other issues. So thank you so much.
Thank you so much. Take care of yourself.
Thank you.